This is our last learning outcome for Module 4, which is learning outcome number 10, where we will be covering calcium homeostasis. Calcium is not only the most abundant mineral in bone, but it is also the most abundant mineral in the human body. Calcium ions have several functions besides being needed for bone mineralization. It is going to be important for your tooth health, for regulation of heart rate, and also the strength of the contraction of the heart, for blood coagulation, for smooth and skeletal muscle cells contraction, for the regulation of nerve impulse conduction, which basically means that it is the signal that is sent from one neuron to another. And the normal level of calcium in the blood is about 10 milligrams per deciliter, as we can see over here from this image. And when the body cannot maintain this normal level, a person will experience either hypocalcemia or hypercalcemia. Hypocalcemia is a condition that is characterized by abnormally low levels of calcium, since hypo means below. As you can imagine from all the functions I mentioned above, this can have an adverse effect on a number of different body systems, including cardiovascular, muscular, nervous, and skeletal systems. Without the adequate calcium, blood has difficulty coagulating, for example. This means that if you have an injury, you might bleed to death. Another symptom that may occur is that the heart may skip a beat or even stop beating altogether. For muscles, the low levels of calcium may signify that the muscles might have difficulty contracting, the nerves may have difficulty functioning, and for bones, since we are in the module about bones, it may become brittle or even break easily. Now, the causes for hypocalcemia can range from hormonal imbalances to an improper diet. Treatments, they're going to vary according to the cause, but the prognosis are generally good, meaning that if diagnosed early enough and you follow your doctor's orders, you'll be okay. Conversely, hypocalcemia is a condition that is characterized by abnormally high levels of calcium, since hyper means above. This will make the nervous system be underactive or underperforming. This will result in lethargy, for example, a person being sluggish or having sluggish reflexes, constipation, loss of appetite, confusion, and in severe cases, even coma. Obviously, calcium homeostasis is critical to our survival. The skeletal, the endocrine, the digestive systems, they're going to play an important role in this, but the kidneys do too. So the urinary system will also play an important role in calcium homeostasis. These body systems, they will work together to maintain a normal calcium level in the blood. And an interesting fact about calcium is that it is a chemical element that cannot be produced by any biological process. Therefore, the only way that it can enter the body is through your diet. Once you eat something that contains calcium, the bones will act as a storage site for calcium. This means that the body will deposit the calcium in the bones when the blood levels get too high, and it will release the calcium when blood levels drop too low. This process is going to be regulated by three main factors: the parathyroid hormone, vitamin D, and calcitonin. Let's talk first about hypocalcemia, in other words, when there is a low level of calcium in the body. When this happens, it will activate the parathyroid hormone, which is secreted by a gland that carries the same name, which is the parathyroid gland, which are these 4 red dots located posterior to the other big gland that is the thyroid gland seen on this image. They are both located around the trachea, so this large tube-like structure is the trachea. Cells of the parathyroid gland, they have these plasma membrane receptors for calcium. So when calcium is not binding to these receptors, it means that the levels of calcium are low, and this will lead these cells to release the hormone, which is the parathyroid hormone, which will then stimulate the osteoclast proliferation and resorption of bone by these same cells. Remember that osteoclasts are the chewing bone cells. If they are chewing up the bone, they are causing a demineralization process which will release calcium into the blood. In other words, these cells, they are removing calcium from the bone to make it available in the bloodstream. In addition, the parathyroid hormone will promote reabsorption of calcium from the urine by the kidneys so that the calcium returns to the blood instead of being removed by the urine from the body. Therefore, the parathyroid hormone promotes two mechanisms that will increase calcium blood levels. One is by removing it from the bone, and another is by filtering the blood in the kidneys. Finally, the parathyroid gland, it will stimulate the synthesis of vitamin D, which in turn stimulates calcium absorption from any digested food in the small intestine. When all these processes occur and blood calcium levels return to normal, there is enough calcium to bind with the receptors on the surface of the cells of the parathyroid glands, and this cycle of events is turned off. For hypercalcemia, when blood levels of calcium get too high, the thyroid gland now is the one that's going to be stimulated to release a hormone that's called calcitonin, which will inhibit the osteoclast activity, and this will stimulate calcium uptake by the bones. In other words, there will be an increase of calcium being deposited in bones, and this deposition of the calcium in bones is performed by the osteoblasts. So there is an inhibition of the osteoclasts, but there is an activation of the osteoblasts in hypercalcemia. In addition, it will also decrease reabsorption of calcium by the kidneys, and all of these actions will lower the levels of calcium. When blood calcium levels return to normal again, then the thyroid gland stops secreting calcitonin, and therefore everything goes back to normal. You already know that calcium is a critical component of bone, especially in the form of calcium phosphate and calcium carbonate. Since the body cannot make calcium, it must be obtained from the diet. However, calcium cannot be absorbed from the small intestine without vitamin D. Except for fatty fish like salmon and tuna, or fortified milk, or orange juice, or cereal, for example, vitamin D is not really found naturally in many foods. The action of the sunlight on the skin will trigger the body to produce its own vitamin D, but many people, especially those of darker complexion that secrete large amounts of melanin, and also those living in the northern latitudes where the sun's rays are not as strong, they're going to be deficient in vitamin D. And in these cases of deficiency, a doctor can definitely prescribe a vitamin D supplement. Once vitamin D enters into the body, either through the sun exposure or supplements, it will go to the liver and be converted into calcidiol, which is the primary form of circulating vitamin D in the body. In addition to the liver, once it enters the kidney through the circulating blood, vitamin D gets converted into calcitriol, which is a biologically active form of vitamin D. Therefore, synthesis of vitamin D will be important to facilitate calcium absorption from the small intestine, also calcium reabsorption from the kidneys as the blood gets filtered in the nephron, and it will also be important for the rebuilding of bone tissue, as calcium is going to be important for that rebuilding of bone tissue.